Hello, it's Doctor Steven Tugbiyele here, your UroGYN doctor, and in this video I'm actually going to talk about urinary incontinence. This is a question that we get a lot, and I thought I'd make a video and discuss this condition. So urinary incontinence is actually means the accidental urine leakage, and there are different things that can cause accidental urine leakage. It's something that affects many women. As a urogynecologist, I take care of women, so it affects many women, and it's actually been estimated to affect up to 50% of women, particularly women who've had children. So it's very common. It's embarrassing. It's not easy to talk about. A lot of women keep it to themselves and don't bring it up until it's severe in nature, and it affects quality of life. It affects body image. It affects a woman's ability to do activities that she enjoys. So it's something that is actually quite common. It's costly. A lot of women wear pads, and that is at a cost and burden to her life. So it's something that we definitely want to, to discuss. So the different kinds of urinary incontinence. One is called stress incontinence. That's the leakage of urine with activities. So laugh, cough, sneeze, jump, lift, exercise, bending over. I have had women say, "Oh, when I jump on the trampoline with my kids, I leak," or when I do my HIIT training or my Zumba, I leak. There are some women who said they've leaked, when they are being intimate. And some women, I actually had a mom say when she yelled at her kids, she leaked. I said, well, don't yell at your kids, you won't leak. But you get my point that with activities, that causes leakage. And then there's leakage that can occur as a result of not making it to the bathroom on time. So if a woman gets an urge and she races there, but it's kind of, we call that gotta go syndrome, and she doesn't make it there. Or if she wakes up at night several times to use the restroom, or she goes frequently to the restroom, that's called urge incontinence, or that's called an overactive bladder, essentially, where the bladder is overactive and she can't hold it to where it's convenient for her to make it there. There's overflow incontinence, where the bladder just fills. The woman doesn't feel her bladder filling, and then it just kind of spills over and she leaks. That oftentimes is seen in women who have a neurological condition. It may be a woman who's had a stroke or spinal cord injury, where they've lost that sensation of their bladder filling, and then they just leak as a result. And then there's functional incontinence, for example, where women who have a condition, a medical condition that affects them being able to make it to the bathroom on time. So maybe she has issues walking and getting there, so she's in a walker or in a wheelchair, or she may have a tremor and it takes her time to get her clothing off. So those are conditions that are not as a result of there being an issue with the bladder per se, but a medical condition that affects them being able to make it to the bathroom on time. There's coital incontinence, women who leak with intimacy, and there's so many different reasons why women can leak. What are some of those risk factors? Aging is a top one. As women get older, the likelihood of developing incontinence increases. Women who've had children, compared to women who have not had any children, are at a greater risk for accidental urine leakage. Women who have had vaginal deliveries compared to women who have had only cesarean sections, planned cesarean sections, the risk is higher in women who've had vaginal deliveries, and many children. Let's see. So, that's kind of laid the groundwork there. And so a woman has this condition that bothers her. What do? Well, we in an evaluation in the office, oftentimes we start with doing a survey of her eating and drinking habits. So we ask women to fill out something called a voiding diary, where they record what they drink, how much they drink, if there's leakage, how much leakage, when the leakage occurs, and what provoked the leakage. It's with an urge or activity or both. And there are some women who have mixed incontinence, meaning they leak with laugh, cough, sneeze activities as well as an urge. And so in examining a voiding diary, we can see, we can determine, is she drinking enough water or not? Because we know not drinking enough water is not good, drinking too much water is not good, so a happy medium is important. Is she drinking things that can cause more urgency, like coffee, tea, sodas, artificial sweeteners, alcoholic beverages, carbonated beverages, acidic juices? You can tell I've said this quite a bit. So those things can cause more urgency. And so those are things that we can actually do. And does she have medical conditions that we know can increase the risk of incontinence, like I talked about? Then we talk about the benefits of pelvic floor muscle exercises. Some of you may have heard the term Kegel exercises, and these are the exercises that if you were to want to stop the flow of urine midstream, these are the muscles that women would squeeze to stop the flow of urine. A lot of women remember being told this around the time they have had children. Oh, do your Kegels, and that's meant to keep the pelvic floor muscles toned, because when a woman gets an urge, if she squeezes her pelvic floor muscles, that will help her not help the urge actually diminish to the point where she can make it to the bathroom. And if she has strong pelvic floor muscles, then the likelihood of leaking is less with activities. But a lot of women who see us as urogynecologists don't do Kegels regularly. And I always tell my patients 100 Kegels a day keeps the urogynecologist away. It's kind of a catchy phrase that is easy to remember, but the point is, the more Kegels a woman does, and the more frequently she does it, the better. Or some women who have difficulty locating their muscles, we refer for pelvic floor physical therapy. These are specialists who would see women once a week for about an hour over the course of 2-3 months to help women regain strength and tone to the pelvic floor, and that can be really helpful. In terms of what are other solutions, there are medications that women can take if they choose to help calm the bladder down, and so that she has more time to make it to the bathroom on time. Oftentimes these medicines can help women not have to wake up from sleep as much, so they can, her sleep is not being interrupted by leakage or by the urge to go, and then she doesn't have to go as frequently during the day, and she has less of an urge, so she has more control. These medicines, they do help, but there are side effects that also associated with these medicines. So again, a good evaluation in the office and discussing the pros and the cons is very important. And then there are procedures that can help with either resupporting the urethra if the leakage is due to laugh, cough, sneeze leakage, or helping to calm the bladder down, the muscle or the nerve of the bladder, to help with women holding urine longer, so they don't have to run to the restroom. So that kind of summarizes what urinary incontinence is, or accidental urine leakage. It's very important that women know that it is very common, affects many women, that women don't have to live or put up with it. There are good options that work, are safe and effective, and getting in to see and be evaluated by a pelvic floor female specialist or urogynecologist like myself is key, because of our training. We are trained to know how to diagnose and manage and ultimately improve a woman's quality of life. So that kind of wraps it up. If you want more information like this, you can visit my website, Doctor Steven Tugbiyele. So that's Dr. Steven with a PH, Tugbiyele .com, and you can get more information, or go to my YouTube channel, Doctor Steven Tugbiyele, which I'll be putting more videos out there. Really, I'm very passionate about educating women, and so hopefully this video added value to your life, and there'll be more videos I'll be making to help to educate women about their pelvic floor health. If you're in the Metro Atlanta area, or if you are in the Southeast, we'd love to see you in the office and be able to help you. You can visit my practice website. That's Northside Center for UroGynecology.com, and the office number is 470-325-1280. Okay, so till the next video, take care. Bye.